That being said, everybody, offline, I had a patient give me a challenging moment this past week. So I called Dr. Diane to discuss how often she sees mold and Lyme together because it seems like I'm seeing it far more often.
It is so common we see these things together. And I think some of it, there's a couple of different reasons why. I mean, some of it is just a simple awareness factor around symptom wise. The symptoms from mold illness, the symptoms from Lyme disease can be so similar that one of the things that I find happens so frequently is people get one of these hats these put on them diagnostically. So a doctor will diagnose them with mold illness or something like chronic inflammatory response syndrome. And because they have that diagnostic label, nobody has actually then looked for the Lyme or vice versa because there's this symptom similarity. So I think that's one component of it. And like you and I were talking on the phone, I also think another component that's happening is we know that Lyme can go dormant. We know that some of the standards of care that we've been using for years, such as doxycycline, amoxicillin, some of these standards of care for Lyme disease actually will cause the bacteria that creates Lyme, Borrelia burgdorferi, will cause that bacteria to go into this dormant persister form where it's cleared from the blood. Oftentimes people feel better, but it's not cleared from the body. And then people get into these mold infested homes and they have a genetic predisposition for mycotoxins building up in their body, which we know is a very common genetic predisposition to have. And once they get in these homes and their immune system starts really kind of going haywire, to speak very simply about it. And then once their immune system is, say, busy and doing other things like trying to find the mycotoxins inside the body, it creates enough of an internal stressor that then that Lyme disease that was in that persister dormant form, sometimes from decades ago, starts to reemerge, similarly to somebody with chicken pox getting shingles, but obviously a lot more intense and severe than that.
Yeah, I feel like and as I told you, I try not to, from a testing standpoint, try to be the person who helps identify and care for the patient with Lyme because we cover a lot of bases in our program, and you gave me some insight. But what I get a lot of now is feedback about a Lyme flare.